Good morning. Today we're going to talk about an exercise for your back called the pelvic clock. The pelvic clock is a series of motions where you move your pelvis in certain defined ways to help mobilize your low back and help relieve your back pain. There's 4 classic motions to the pelvic clock. There's 12 o'clock, 6 o'clock, 3 o'clock, 9 o'clock. At Linder Physical Therapy, we add another motion, and that's called wind the clock. We're about to do those laying down, and you might, from this camera angle, you might not get a great visual of everything we're doing. So we're going to try to show you different angles of the pelvic clock motions through this video, and hopefully you have a good understanding of how to do it. So let's go into the pelvic clock today. Okay. You can lie down on any surface. What I'm lying on today is a mat table in our gym. You can lie down on the floor. You can lie down on a bed. Any flat surface you have, you can lie down on. The first motion, the 12 o'clock motion of the pelvic clock, is I'm tilting my hips, pushing my back into the mat. I'm tilting my hips up towards 12 o'clock. Like most of our exercises, we're looking at repetition. The more you do an exercise, the better, providing it's comfortable. If it hurts to do a real good pelvic clock, but it doesn't hurt to do a real small pelvic clock, then do a small pelvic clock. Eventually you'll be able to do a full pelvic clock without too much difficulty. So this motion, tilting my back down into the mat table, into the floor, is 12 o'clock. The next motion, the opposite, would be pushing my tailbone into the mat table or into the floor. And when I do that, I arch my back just a little bit. My back's coming off the mat, and I'm tilting my pelvis down, going into a 6 o'clock tilt. And again, we're going 25 reps. Next would be coming up on my right side, which to me is the 3 o'clock motion, but if you're looking at me do it, you might think it's the 9 o'clock. I'm pulling my pelvis straight up sideways, not lifting my pelvis up. I'm pulling my pelvis straight up sideways. You might see this better. We're going to do a standing version of this in a minute. You might see it better when I'm standing up. It doesn't matter if you do this lying down or standing up, and I'll talk about that later as well. So here's, to me, the 3 o'clock motion, pulling my right hip towards my rib cage. And then on the other side, I'm going to pull 25 times, trying to pull this side of my pelvis up towards my ribs. And I'm doing everything about 25 times, and then rocking my knees side to side. You don't need to rock your knees fully to the side. If you want to, you can, again, as long as it's comfortable. What we're trying for is nice, gentle mobilizations. So, moving your hips easily through rotation of the pelvis. Frequently in therapy, what you'll hear somebody call this knee rocking. What we're really doing is pelvic rotation, where the pelvis is turning side to side. We're mobilizing the sacrum on the pelvis. We're mobilizing the pelvis on the vertebrae, mobilizing the vertebrae on each other. When I say mobilizing, what I'm really saying is moving. But just getting that nice gentle motion to occur helps open up and gap the vertebrae, the pelvis, the tissues of your low back, so you move more comfortable. After you go through a series of 25 or 10 or 15 or 25 of each of these motions, go through them again. And you might repeat this whole series, pulling your pelvis up, pushing your pelvis down, pulling your pelvis up sideways on one side, pulling it up on the other, rocking side to side, rotating your pelvis side to side. You might repeat this 2, 3, or 4 times every time you do a set of pelvic clock exercises, as you're trying to affect the most comfort in your low back, so you move that much easier. You've seen us do the lying down version of the pelvic clocks. Now we're going to do the standing version of the pelvic clock. The standing version, the nice thing about the standing version is it makes the pelvic clock exercise portable. The lying down version, you can do it on your bed at home and maybe your living room floor. If you have a closed office, maybe you can do it in a closed office on the floor. When we realized that was a limitation of the exercise, we came up with the standing version of the pelvic clock exercise. I'm going to turn sideways, and the first exercise, the 12 o'clock exercise, you want to pull your pelvis up, tightening up your stomach muscles, and you're going to flatten your low back. So you pull your pelvis up into a nice 12 o'clock exercise. If you had a wall to lean against, if you needed the wall, and you pulled your pelvis up, I'm actually pushing my back into the wall. The 6 o'clock is even easier to do. If you put your hands right behind your hips, they'll rest right over your sacrum, the triangle bone at the bottom of your back, and you're going to push that sacrum right into your hands, and when you do that push, you're actually rotating your pelvis down, so you're doing an ideal 6 o'clock version of the pelvic clock. To do the 9 o'clock or the 3 o'clock, stand with most of your weight on one leg, just lightly resting your opposite foot on the floor, and you can pull your pelvis straight up sideways. You're not rotating, you're pulling your pelvis straight up sideways. And then same thing on the other side, put all your weight on the opposite leg, lightly rest that foot on the floor, pulling your hip up sideways. Doing the nice 3 o'clock or 9 o'clock on that side. It's not rotating at all, it's coming straight up sideways. Now, like the lying down version, we also have a wind the clock motion for standing. The wind the clock motion, the easy way is to do it is if you have a hula hoop. You just rotate your hips in a nice little circle, your shoulders roll in a little circle, and right now I'm doing a clockwise hula hoop. So I'll go 25 times clockwise, rotate around 25 times the opposite way. And again, I can do this anywhere. I can do this at my office, I can do this at home, I can do this standing up and watching TV every commercial break if I want. But it's a real easy way of doing the pelvic clocks and standing. Like the pelvic clocks laying down, I might do 25 12 o'clocks, 25 6 o'clocks, my 9 o'clocks, my 3 o'clocks, my wind the clocks, and then do another set, and then do another set. The more sets you do, providing they're comfortable, the better you're going to feel. There's one more version of the circular wind the clock motion. Most guys find it easier to do a hula hoop motion. A lot of girls, especially if they were dancers, want to isolate their pelvis. They don't let their shoulders move, so they're just going to roll their hips in a circle. And that's fine to do. All we're doing is a nice circular motion again, 25 times clockwise, 25 times counterclockwise. So you can either isolate your pelvis or you can do the hula hoop motion, doesn't matter, as long as it's comfortable. There we have the pelvic clock series. I hope it offers you significant and lasting relief for your back pain. I hope it's a real easy tool for you to use. Thank you.